Hello, dear students. Welcome to lecture of Pharmaceutics. Myself, Dr. Jyoti Kapil, Associate Professor, Institute of Pharmacy, Assam Don Bosco University. So, dear students, today I am going to discuss about dosage form, the importance of dosage form, few definitions, and classification. So, let us start with the lecture. So, what is dosage form? Actually, when we take the word dosage form, most of the time we get confused between dosage form and a dose. Okay, so the drug is a chemical entity which is required to bring down or to cure any kind of disease or ailment, right? And that drug as such cannot be taken. The reason is that those drugs are either unstable in the atmospheric condition because of presence of light, moisture, heat, etc., or else because of its taste or smell. The taste might be bitter, unpleasant, or foul. So because of that reason, the drug needs to be converted to a suitable entity which we can easily take and which will also protect the drug as well as bring the drug inside the body at that part of the body where it is required to show the therapeutic effect. And that thing which is carrying the drug inside the body at that part of the body where it is required is dosage form. Okay, so what is dosage form? It is the carrier of the drug, which is also known as active pharmaceutical ingredient, inside our body safely and precisely. Okay, so for example, when we need bricks, for example, to build our house, the truck that will bring the bricks is the dosage form, and the bricks is the API or the drug which will be used to build our house. Okay, so the dosage form will only help to bring the drug safely. Okay, and in that term, when we are using safely, it also means it will also protect the drug from any kind of degradation. Okay, so this is dosage form, so it will help also the patient to take the drug easily by masking the taste. If it is bitter, the dosage form will not allow the drug to directly come in contact with the your mucosa so that you will not feel the taste. Okay, so it will also help the patient to overcome any kind of bitter or unpleasant taste. Then also it helps in optimized release. That means suppose a drug is there which get degraded in your acidic condition. So at that time, if you convert the drug to a dosage form and put the dosage form as in a coating, okay, which is called as enteric coating, then it will protect the drug to get exposed to acidic condition, and as thereof the drug will not get degraded. Okay, so these are some of the reason why we convert drug as a dosage form. Okay, so similarly, like suppose paracetamol. Suppose 500 mg of paracetamol a patient needs to take, but paracetamol is generally a powder. So if you take 500 mg of powder every time, there's a chance that some powder will get wasted during weighing, or some powder will stick to the butter paper that we're wearing when weighing, or maybe there might be some mistake while weighing also. So because of which it will be better to convert that 500 mg of powder to a solid tablet, for example, where you don't have to weigh, you just need to take a solid tablet and swallow, which will make it very convenient, as well as the dose will be properly maintained. So now I think we all have understood a little bit what is dosage form and what is the need of dosage form. Now let us discuss the classification of dosage form. Okay, so when we come to the classification of dosage form, it can be broadly classified into 4 categories. Okay, solid dosage form, liquid dosage form, semi-solid dosage form and the aerosol or gaseous dosage form. Since solid, liquid and semi-solid are the basic of dosage form, and we are very new to this topic, so I am now only discussing these three dosage form. The gaseous dosage form, mostly the aerosols and all, will be discussed in the later classes. So let us start with solid dosage form. So what is a solid dosage form? Solid dosage form is a type of dosage form which will be solid in nature. Okay, like for example, tablet, capsule, or the powder that we apply. Okay, all these are solid. Okay, so the solid dosage form can be classified further as unit and bulk. So what is unit dosage form and what is bulk dosage form? Unit dosage form of solid is that where we can count the dose or the doses from 1, 2, 3 like that. Okay, where each doses form can be counted, or each dose of any drug will be present in a single doses form. Okay, like for example a tablet, we can count the tablet 1, 2, 3, and each tablet will have only one dose of a particular drug. Okay, it can have 2 drugs, 3 drugs, but the dose of the drug will be only one. Okay, so you have to count, you can count it, as well as we need to take only one at a time. Okay, that is unit dosage form. Whereas in bulk dosage form, like your powders and all, there are many doses. Okay, many doses of same drug can be present together. Okay, so suppose one can of a powder is there, from that you need to apply whenever required. Okay, but not complete can needs to be applied. So many doses are there. So in one application, one dose will come out, next application again another dose will come out. Okay, and the difference of both is that in unit dosage form, the dose can be precisely monitored, so that each tablet or each capsule will have, or the powders that is mentioned in the unit dosage form is about a powder which is packed in a single dose sachet. You will just tear the sachet, you will consume. Okay, so there is dose of the drug will be properly maintained. But in bulk, sometimes it is difficult to maintain the dose. Okay, because if the patient is taking out more powders, then more than one dose of the drug can also come out. Okay, or sometimes if less powder, less amount of drug can also come. Okay, so unit is where single dose is present, where we can count the doses from. Bulk is many doses are present, where it is difficult to count how many doses are. Okay, so then this bulk is again classified as internal and external. Internal is that which we will take inside our body. External that we will apply onto our body. Okay, so what are these? We will discuss in the next class. Next classification is liquid dosage form. That means the dosage form which are in the liquid form. Okay, so liquid form like what? The paracetamol syrup that we take. Okay, or the lotion that we apply to our body. All these are type of liquid dosage form. Okay, so this liquid dosage form are further classified as monophasic and biphasic. Okay, now what is monophasic and what is biphasic? Monophasic dosage form is that where only single phase of the dosage form is present. Okay, only one phase, that is the liquid phase. Fine. In the biphasic, two phases are present. Okay, that means the liquid will be present, along with that there will be either immiscible liquid or there will be insoluble solid. Okay, so when we say this, I have to again tell you what is a solution first. Okay, now what is a solution? Solution is a combination of two parts. One is solute, excuse me, one is solute and the other is your solvent. Okay, so solute is that which will be present in less quantity, solvent will be that which will be present in more quantity. Okay, so if the solute is completely soluble in the solvent, it is a solution, true solution. If the solute is not soluble or insoluble in the solvent, it becomes a heterogeneous mixture, which is your suspension. Okay, so let's start with monophasic first. So in internal monophasic, we take inside our body are your syrup, elixir, linctus, drop. Okay, what are these? We will explain. In external, it is liniment, lotion, eye drop. okay, that we are applying, okay, or we're taking in some cavity of our body. And then your biphasic is emulsion and suspension. So what is emulsion? It is again a biphasic, but what is present here? Two liquids, but they are immiscible. Okay, they are not miscible with each other. Like for your example, your oil and water. Oil and water are immiscible. Okay, so emulsion is a mixture of oil and water where they are immiscible. Okay, but when we mix, suppose we are taking a beaker, we are placing water, okay, 50 ml, then we are adding 10 ml of oil. Okay, we can see that both the layers are separated. Now a formulation cannot be like that. Okay, so what we need to do, we need to, if we mix the oil and water, we will see that the oil will break down a small droplet inside the water. Okay, so that is emulsion. But what will happen after some time, when you keep the beaker aside, again the oil will separate out as a separate layer. Okay, so to avoid that, to avoid the separation, we add a third substance to that, which is known as emulsifying agent. Okay, so emulsifying agent will make the unstable condition stable. Okay, so the emulsifying agent will make those droplets of oil that we have found after mixing to remain as such dispersed in the water. Okay, so that is the function of emulsifying agent. Okay? So emulsifying agent will help the homogeneous dispersion of the oil in the water or water in the oil in case of emulsion. Okay? So emulsions are what? Biphasic liquid dosage form where two immiscible liquids are present which are made miscible by the addition of emulsifying agent. Okay, clear? Next is suspension. What is a suspension? Suspension are again biphasic liquid dosage form, but solid particles present in the suspension. Okay, so when insoluble solids are present in a solvent, they are known as suspension. Okay, what is suspension? Biphasic liquid dosage form where insoluble solids are present in a solvent. Okay, and they are made homogeneous by the addition of suspending agent. Okay, so in emulsion we are adding emulsifying agent, in suspension we are adding suspending agent. Okay, now what is suspension? Let us discuss a little bit. So suppose for example we take a beaker of water and we add few solid particles which are insoluble in water. We stir the water and the solid. What will happen? The solid will come throughout the water as small particles. Okay, but after some time when we keep it aside, the solid will settle down. Okay, or will float depending on the density. So this floating or settling of the solid in the liquid is unacceptable. Okay, so we need to keep the solid remain dispersed in the liquid, and that can be done by the help of suspending agent. Suspending agent will help the solid get suspended or remain suspended in the solvent, the liquid. Okay, so suspension, what will happen? The solid will be present in the liquid without settling or floating, and even if they settle after certain time, just by gently shaking the bottle, they will get redispersed. That is suspension. Okay, I hope you have understood liquid dosage form. Okay. Next is your semi-solid dosage form. And what are semi-solid dosage form? These dosage form are those which will have the characteristics partially of a solid and partially of a liquid. Okay, like your cream, okay, gel, paste, all these. So these semi-solid are again classified as internal and external. So internal are those which will take inside the body, external which will apply to our body. Okay, so external are those like ointment, cream. Okay, like for example, if we get hurt, okay, we apply some ointment. Okay, povidone ointment, or sometimes if there is pain, we add some analgesic ointment or pain relief ointment. Okay, then some creams in summer, winter, we use some creams. Okay, all these are external semi-solid dosage form, and internal are your suppositories and pessaries. Okay, so these are again semi-solid dosage form, where suppository is a your unit dosage form. Okay, just like tablet, we can count a suppository. Okay, but the difference is that in your tablet, we consume the tablet orally, whereas suppositories we don't consume, we insert it in our body cavity. Okay, and in suppository we use suppository base. Okay, so what is suppository, what is pessaries, all these different doses form we will explain in our next class. So in our this class we have discussed about what is the dosage form, what is the need. Okay, then different classifications, different examples inside these classifications. Okay, all these things we have discussed. I hope you have understood this properly, and rest we will discuss in our next class. Thank you. Have a nice day.